Good morning, everyone, and welcome to another Henry County Health Center FYI. In observance of March as Colorectal Cancer Awareness Month, we are talking with Dr. Michelle Tansey, the General Surgeon at the Henry County Health Center, and she's going to talk about colorectal cancer and the services offered here at the Henry County Health Center. Good morning.
Good morning.
So let's first just start with how long you've been at the health center, how long you've been a surgeon, what types of surgeries you do, etc.
Well, my name is Dr. Michelle Tansey. I've been here at Mount Pleasant at Henry County Health Center since 2009. I received my training in Chicago at the University of Illinois, and I have been a surgeon since 2002, so I'm not super young. That being said, I do a lot of general surgery that involves below the neck. So I do colon cancer, breast cancer, gallbladder surgery, hernia surgery, colonoscopies, stomach scopes. That's the largest portion of my practice.
Wow, that's great. And you do that all right here in Mount Pleasant?
Yes.
Awesome. So let's jump into colon cancer because that's what we are here to talk about this morning. What is colon cancer? What are the signs and symptoms of it?
So colon cancer happens when there's extracellular growth of the surface of the colon. We often identify that in polyps if we catch the colon cancer early. Signs and symptoms of colon cancer, unfortunately, we identify when the cancer's already been more involved. And what I mean by that is that if you're having problems with abdominal pain, weight loss, and you're not trying to lose weight, any blood in your stool, those are signs and symptoms of having colon cancer. Now, not all abdominal pain, of course, is colon cancer, but abdominal pain that is out of the ordinary, meaning does not get better with Tylenol or ibuprofen, or if it's affecting your appetite, those are concerns for symptoms for colon cancer.
So, even people who don't have colon cancer and don't have symptoms probably should be screened. And can you talk about what that is, why it's important, and what age people should start thinking about these things?
Thank you so much for that question because so much has happened in the last 6 months in regards to colon cancer screening. So we like to screen people or look for colon cancer before you have symptoms because it gives us many options of how to treat patients. It's so much easier to treat someone with a stage 1 problem than a stage 4 problem. But for the purposes of this conversation, the United States Preventive Task Force in May of 2021 has decided that we should start screening people at age 45, all men and all women, because we're seeing an increased incidence of late-stage colon cancer in people below age 50. So in order to combat or to reduce people dying from colon cancer less than the age of 50, all insurance companies will cover a preventive screening colonoscopy at age 45.
Yeah, that's so important. I mean, not to get too personal, but my grandmother actually passed away from colon cancer. And it was one of those things where
Oh, I'm so sorry.
she had that pain for a long time and never really did anything about it. And then when they caught it, of course, like you said, it was kind of past the point of being able to do anything about it. So, yeah, this is something that's super important to me just because it affected me personally. Um,
Right.
so anyway, it's important to get screened. It's important to go in for that colonoscopy. I'm glad that you had updated information to share. But let's talk about you as a general surgeon and the specifics that you do with colon cancer here at the Henry County Health Center.
Well, one of the reasons it's wonderful to come to Henry County Health Center, and specifically me, is that I have the ability to see you in my office, discuss the risks and benefits of getting colonoscopies, as opposed to other tests like a Cologuard or a FIT test, which are great and valuable tools, but they are not therapeutic. So the wonderful thing about getting a colonoscopy, which nobody's excited about, is that the prep for the colonoscopy has improved, meaning that it is less nauseous and causes less cramping. The second thing is that by identifying the polyp in the colon when it's the size of an M&M, we can remove that polyp and markedly reduce the risk of you getting colon cancer. In fact, in the last decade, we have reduced colon cancer statistics of people dying from colon cancer almost 30% by doing routine screening, and that was for age 50. So I imagine in the next decade, when now we're screening at age 45, that's going to improve. But the wonderful thing about coming to Henry County is that I can do your colonoscopy. I can unfortunately tell you if you have some bad news like colon cancer. I also, if we find the colon cancer at an early stage where it involves removing a part of your colon, which is unfortunate, but the gold standard of treatment or what needs to be done to keep you safe and alive on this planet, we can actually do that surgery here at Henry County Health Center by removing part of the colon. Now, the reason why I say we can't do it all the time is because if it's in the liver or the lungs or if it's gone somewhere else, that is beyond our capabilities at Henry County. But colon cancer surgery can be done laparoscopically or the old-fashioned open procedure here at Henry County. And if you need further treatment with chemotherapy, that can also be done at our infusion center at chemotherapy. We work very closely with the Southeastern Iowa Medical Center oncology group that comes to our institution once a week to assist us with not just chemotherapy, but other oncology treatments.
I love that. I mean, if I found out that I had, let's say, colon cancer, I would be so grateful that we could probably take care of it quicker because I could just get it done right here in Mount Pleasant.
That's correct, yeah.
So you talked a little bit about the infusion center here at the health center. Are there other treatments offered at the Henry County Health Center for individuals that have colon cancer?
Yes, so for the standard of care for colon cancer, sometimes radiation treatment is required, and we also can offer that through our colleagues at the Southeastern Iowa Medical Center. But the oncologist can do bone scans here, can do CT scans, MRI, for all the evaluation and surveillance of your colon cancer. They can also provide chemotherapy. We can also do all of our laboratory work that needs to be done here to follow people with colon cancer. And so other than radiation treatments, everything else can be done here at Henry County Health Center.
That's fantastic. What can be done to help reduce the risk of colon cancer?
You know, once again, a great question. We're always looking for a magic treatment to reduce our risk. So the first thing is just get younger. So the greatest risk of any cancer is your age. So as we age, cells just don't replicate as well. Some systems break down. So just by getting older affects our ability to get cancer. That being said, they say maintain a healthy diet. There is some relationship, they think, between increased red meat intake and things like that. But that's very, very early data, and it's not well supported. But having fruits and vegetables in your diet, increased fiber in your diet markedly reduces any type of cancer, but especially colon cancer. There is some discussion in the literature about aspirin possibly reducing your risk of colon cancer. But there's also things in the literature saying 1 cup of caffeinated coffee also reduces the risk of colon cancer. And so it just depends on how much you read and who you believe. But maintaining a healthy diet, getting 8 to 9 hours of sleep every night, and watching your weight. And also that includes being a non-smoker or giving up smoking and vaping.
Yeah, all important things. I mean, just to be healthy in general, to reduce your risk of cancer, probably in a lot of different types of cancer. Eat healthy, get sleep, drink water, all those good things. So if people want to schedule a colonoscopy, what should they do? How can they do that? Who should they contact?
There's multiple ways to get scheduled for a colonoscopy. The best and easiest way is just go ahead and give my office a call at 319-385-5374. And Diana will be happy to help you and get you scheduled to see me. Another option is go through your primary care physician. They have my number as well. So whatever avenue patients, if they're in their office seeing their regular doctor or provider, they can call my office, or you can call that number 319-385-5374 and get scheduled with me at your earliest convenience.
And what about additional resources? Are there resources available for people to learn more about colorectal cancer?
Yes, there's tons of resources out there, but I'll give you my top 3 favorite because I don't want to overwhelm people. CDC.gov, colorectal cancer, is probably one of my top favorite because you can pick out Iowa statistics. You can see who in Iowa is getting colon cancer, what the trends are, how old we are getting colon cancer, and things like that. So it's got great statistics, but people might find that boring or not as informational. Another great website is mayoclinic.org. You can type in colorectal cancer or colon cancer, and they'll say, hey, these are the signs and the symptoms. If you've got a problem, please call your provider. And once again, they can lead you to local resources. And my third and final one is the American Cancer Society. Now, people don't think, oh, gosh, I don't know what problems I'm having. I don't know if I want to go to a cancer website. But they've got wonderful information, very straightforward, very easy to understand for patients, and that's at the American Cancer Society.
Yeah, of course, there's always that risk of being Dr. Google and diagnosing yourself, but that's why you're here.
Yes.
But it's always a good thing to be informed and to research and look it up. So you need both. So I appreciate you sharing those resources with the listeners. Is there anything else, Dr. Tansey, that you wanted to speak on about colon cancer, about colon health, any of that?
So once again, just maintaining a healthy diet, getting lots of water, getting more fiber in your diet. Fiber is an unsung hero. Easy ways to get fiber are with fruits and vegetables. If you don't have time, it takes actually a lot of money and a lot of expense to not only get your fruits and vegetables, but then to eat them in a timely fashion so they don't spoil. Fiber supplements are the way to go. My two favorite are Benefiber and Fiber Gummies. They're sugar-free, they're candy, they're portable. And fiber not only helps reduce, once again, all types of colon cancer, but it also reduces cardiovascular disease. That is one thing two things I want to mention. One, cancer is the second leading cause of death in the United States of America after heart attack and stroke. So you're about 10 times more likely to have a heart attack or stroke problem. But this is Colon Cancer Awareness Month. Colon cancer is pretty sneaky in that by the time you have symptoms, it's going to be harder to treat. So if you're age 45 and you have a colon, get your colonoscopy. It's straightforward. It takes a day out of your work life. It will save your life. And if it's normal, which it is about 92% of the time, you don't have to see me for a decade. And hopefully in 10 years, we'll have a better and more efficient way to look for colon cancer.
Absolutely. Dr. Tansey, thank you so much for taking some time to talk to KILJ listeners about colorectal health and colon cancer and all of this stuff. It's been really informative, and so I appreciate you coming on this morning. Dr. Tansey is a general surgeon at the Henry County Health Center.
Thank you.